Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Let's talk about how medication side effects might present as adverse behaviors. Medications can have all kinds of different side effects. And most of us, if we are able to verbally communicate our feelings, could say, hey, I take this medicine and it upsets my stomach. Or I take this medicine and I feel dizzy, or I get a headache. We can communicate it, and we can also correlate the taking of the medicine with the symptoms. So we can usually figure out what's going on, that it's the medication causing it. But in a person who doesn't use words to communicate, that can be a real challenge. So one of the first things to know is that if you're supporting someone who is starting a new medication, you need to pay extra attention to any type of change in behavior at all, because it could be indicating that the medication is having a side effect. Some of the things that you might see a person refusing to eat. Well, it's like, why would a medication cause someone to refuse to eat? Well, if it upsets their stomach and they can't tell you, they may just simply refuse to eat. They may push away food. They may become aggressive. They may not want to go to the table to eat because their stomach is upset, and it could be because of the medication. You could see, say, a person just start scratching themselves more. Even if you don't see a particular rash, some medications can cause itching as a side effect. So if you realize that somebody started a medication and then they start having itching, scratching themselves, could be a medication side effect, and you need to let the nurse or the healthcare provider know what's going on. You might see a person start to fall when they started a medicine. What could that mean? Well, it could mean a few things. It could mean that their blood pressure is low. Let's say it's a blood pressure medicine and it's working a little too well, and so they stand up and their blood pressure drops and then they fall. It could be that the medicine's making them dizzy as well, messing with their coordination as well. So, again, if you see a person that was started on a new medicine and they start to have falls or difficulty walking, a change in their gait, think about the medicine causing dizziness type side effects. You might see weight gain. Some medications cause weight gain. Some medications cause weight loss. Some medications make it harder for us to think. Some medications mess up our thinking ability, especially things like some of the seizure medicines can do that. Some of the psychotropic medicines can do that. So a person may change their level of activity, their level of alertness, their level of interest in things. All of those things could be medication side effects. So the big thing to remember is that when someone starts a medication, you need to pay extra attention to different behaviors that you might see or changes in a person's behavior, and make sure that the medical person knows about it and can evaluate them for possible side effects. Thanks for joining me today. We'll see you again soon. Many of the topics that you hear on Medical Mondays comes from the book Clinical Pearls in IDD Healthcare. It's a great resource guide that provides helpful clinical information to anyone who provides support for people with intellectual and developmental disabilities. This includes family members, direct support professionals, nurses, physicians, and others who work in the field. You can find it at replacingrisk.com. That's replacingrisk.com in our store.